Huge pharmacy news. We have a brand new FDA approved nasal spray called Cardamyst, which if I'm saying it wrong, don't make fun of me yet because this is a brand new medication. And the generic is etripamil. This medication was FDA approved to treat episodes of paroxysmal supraventricular tachycardia, or PSVT, which is a lot easier to say. PSVT is when your heart starts beating really fast, pretty much like out of nowhere, because of a short circuit in the heart's electrical system. And this can feel really scary, like pounding, racing, chest discomfort, dizziness, pretty much feeling you're gonna pass out. And then I'm sure you're wondering, wait, should I be prescribed this just in case? This is only gonna be prescribed to adults who have a known recurring PSVT. They will be seen by a cardiologist usually for this. And the reason why this is so huge is that before Cardamyst, there were really no FDA approved medications that you could be using at home. You usually would have to go to the hospital because right now people are usually recommended to try vagal maneuvers before going to the ER, which that's like bearing down, coughing, or using cold water on the face. And then they may end up having to go to the ER for IV medications if that doesn't work. And so now patients can have a self-administer option that they can do right at home. You'll notice that there's 2 nasal sprays in there because if symptoms persist after 10 minutes, they can then use a second one. And I'm sure you're wondering how it works. So this is pretty much a fast-acting, short-duration calcium channel blocker that helps slow electrical signals in the heart to reset the rhythm. Let me just give you an analogy real quick. Imagine your heart is a car engine that starts revving up way too fast. Cardamyst is pretty much like gently tapping the brakes to bring the engine back to a safe speed. And side effects that you need to know are going to be like nasal irritation, congestion, runny nose, throat irritation, even nosebleeds. And because this may cause dizziness or fainting, always have patients sit down when they're using it.